The first step, so IVF, so what you do is IVF is just an umbrella of different technologies where you have sperm and egg outside the body. Depending on the diagnosis, why they need to do this, then you apply certain technologies through that process. But the ultimate kind of issue is it's difficult to get eggs outside of the body. The other challenge is the technology is not perfect. Also, the biology is not perfect. Human beings are notoriously not good at reproducing as compared to like our mammalian cousins, mice or dogs.
Gotcha.
Like you put two perfectly paired people together, they try to have a baby, about 25% per month. That's your baseline. So then now you start kind of applying now there's a problem. Depends what the problem is. Now you have a problem that you're trying to overcome, but you need the eggs. So when you describe the woman takes some medicine, so she takes medicines for about 2 weeks. What these medicines do, they make a group or a cohort of eggs grow. And it all depends on her biology to get that group to grow. And then after about 2 weeks, we extract those eggs through a very, very minor surgery. It's like with just a needle. And now we have the eggs outside the body, and then we fertilize them. Put them in an incubator, and then allow those fertilized eggs to grow into embryos. The first question is, why not just extract one egg at a time and see what happens? You could do that, but the problem is the process of attrition. So if you pull eggs out of an ovary, not all of them will be mature. Probably about 75% will be mature, and like it could actually fertilize. Then you put you couple the sperm and egg together. How many will actually fertilize? And we have a variety of technologies to help overcome certain issues. Well, with all things optimal, about 75%, 80% will fertilize.
Okay, so you go 70% and then 80% of the 70%. So now you're down to roughly like 56%.
Yeah, so let's just break it down with like 10. So you got 10 good eggs. Now we're down to 7 fertilized eggs. Then back in the incubator, they go and we allow those fertilized eggs to turn into embryos that will become that can implant. About 50% will do that. So now we're going from 7 to 3. So then now we have 3 embryos. Now at this point, you brought up things, we should just put them back and hope they stick, hope one sticks. What we do now is we actually can test them. So that we can do genetic testing on these embryos and we can tell which embryos will implant and which ones won't. It's not exact, but we can definitely tell which ones won't implant. So with those, now you're down to 3 embryos, right? And we test them. We actually freeze them because it's a process that takes time. You get a little report with each one of these embryos and you can say, this embryo will implant, this one won't. This embryo could implant, but if it does, it would be a first trimester loss. It could be a second trimester loss. And this is it's really scary. It's like, oh, this embryo would be a third trimester loss with like profound birth defects, not compatible with life. So you can see all that.
You can see that
before you put it back. Now but the main tool is you can know this is the group that could be a viable baby, could be, and these ones will never be. Even though they're live embryos, they will never be a baby. You can say that with a surety. And so now, but now that's where maternal age, you brought up the geriatric pregnancy. This is where age comes in. With someone who's say 25, you have 3 embryos. A 25, 1/3 of those embryos are going to be abnormal, would never implant.
Okay, so you're down from 10, you're down to 2. That could make a viable, healthy baby. Could make it.
Could make it. And now, but let's do. Most patients aren't 25. Let's say she's 35. About 50%, 50 to 60% are going to be abnormal. So now you're down to hopefully now you're flipping a coin. Get a quarter out 3 times and flip it. You'll probably get 1 normal.
Okay, and that's before you even put it back into the oven.
Exactly. So now this answers the question, why do we need so many? You get down to that point. So, but the good news, you flip that quarter, the probabilities, right? Yes, we have a normal embryo that's healthy. Then we go to put it back. Then now the odds are really good. It ranges. Depends on the clinic, the embryo, the uterus. There's a lot of factors.
Sure.
Most patients, it's about 50 to 75% success. So it's there. But if you only have 1, on our best day, you still have 25% walk away with nothing. That's starting with 10 eggs.
Golly.
So that's why we want to fertilize so many, because in the end, you're probably only get that 1 baby.
And that's, so again, when you're saying you go from the 10 to the 1, that you're like viable, we're going to put this back in. You still have human variability with the whole pregnancy, and can the mother actually, is the nutrition correct? Does the body take it correctly? Your attrition from 10 to 1 is really just, hey, does this one even have a shot? And then we put it back in and we're like, please God, let it have a shot. Right?
Fingers crossed. Yeah. Oh, we are. Then you brought, yes, we got it. Yeah. Literally that is going on in our clinic. Yes, we got it.
Wow. And so if you're dealing with a family that starts perhaps later in life that has to go through IVF, you may be going through 1 to, I don't know, let's say just a probability, 1 to 3 rounds of this entire thing to get one successful pregnancy out of this.
Yes.
Like if you're dealing with like, say, a 38, 39, 40-year-old.
Yeah, it just depends on the age, diagnosis, and then kind of like tailored to her is her egg reserve. Like how many eggs does she have? And then age plays back into it. So when we look at that group of embryos, so like I said, a 25-year-old, so 30% will be abnormal. A 40-year-old, 2 out of 10 will be normal. 1 out of 5 will be normal. If a 45-year-old, 1 out of 10 will be normal.
Okay, so in general,
that's not out of eggs, that's out of embryos. You still have to go through that whole process.
Right.
So you take someone who's 40 years old, how many cycles before they can go get that embryo that actually work?
Gosh, man. So how many eggs do you, like, say I walk in and I'm like a reasonably healthy 40-year-old, like, and I'm a woman, which I never have been, but never will be, but I have ovaries. This person walks in and they're like, hey, how many eggs do you have to pull? You're going to say like, we're going to pull 20, or do you really try to pull 10? I mean,
well, it's now it goes back to her biology. So the way the ovary works is all the eggs a woman ever is going to have were made when she was actually an embryo herself. And then they just sit there, and then they're released in these cohorts. That's all genetic pre-programming.
Sure.
We can't control it. No matter, so we can take somebody and we can put them on birth control. We can put them into like medically induced menopause. Still, that process of eggs in these waves are being released. And it's up to the body to recruit one or not. And then the rest just go away. So the body recruits 1, maybe 2, twins happen. And then the rest just go away. They dissolve. And then in our process, we take that group and we apply medicine. We kind of bypass that physiology to get that group to grow. That group is all pre-programmed. So in your average 25-year-old, you get probably 20 to 30 eggs. In a 40-year-old, 6 to 8. If that's your average.
Gosh, you're like breaking all this down. It just seems like an impossible feat just from a statistics standpoint.
Not impossible, but
like obviously not impossible,
but
not
but not easy. And it really
cow.
depends. So then you tailor. So like some 40-year-olds will have you actually can pull more eggs, some less. So 40-year-old comes in, it's like we're gonna only get maybe 2 or 3 eggs at a time. You have a lot of people say, no, I just want to do IVF. And we'll be done.
And we'll be done.
And then it's like, oh, this is you and I this is and you look and it's like, okay, this is what's going on. I think we can get this, but this is going to be a process together. And this is where you rob your couple of eggs. They spent $100K on treatments because they needed so many treatments, so many cycles before they actually got it. But they can get it eventually. It's just not as straightforward as just one IVF cycle.
And correct me if I'm wrong, but we're dealing with an ever increasing in age parent population, meaning like the people that the age where people on average start trying to reproduce and make families, that's getting older and older, right? Like that's not going in reverse.
Oh, correct? No, yeah. Well, and then also, like you said, there's a bit of a misconception of what we can do. Also, People Magazine is kind of a problem where you have...
People Magazine specifically.
Yeah.
Okay, right.
Where you have 50-year-old...
That's oddly specific.
50-year-old celebrities having twins.
Oh, yeah.
That does not happen. They can do it, but they're not their eggs.
Oh, so they're not even getting their own genetics.
Not their genetics, but they can have a baby, or they
can carry the baby, but it's not theirs.
But that doesn't come up in the articles. Like, look at this celebrity. She's beautiful. She's so healthy, and there she is. And by the way, she's 49. So like, if she can do it, I'm perfectly healthy. I can do it too.
Yeah, I'm 5 years younger than she is. I'm 44. I can go do this.
No one puts in there that she used donor eggs.
Oh, wow.
To do this. Donor eggs are extremely successful. They work very well. But that's a different mindset for a couple who comes, we're wired to get our genes into the next generation. And to not do that takes a lot of working through.
So if People Magazine comes out with an article about how Madonna just had triplets, everybody got to calm down. Like, first off, That's not her accent. Second, those are not actually her eggs. She got donated eggs. She got, maybe donated from where, like sperm from wherever.
There's a whole process.
There's a whole thing. And it's like, listen, maybe she carried the kids in a miracle of modern medicine, but this was not her actually producing these genetics.
So, and again, donor eggs are such a terrific thing. And it's a terrific thing that women are willing to donate their eggs to enable the creation of families where there would be none. So it's wonderful, but it's misleading when you see in the news mainly celebrities having kids that are too old to be having that. It's just not. It's not possible.